Healthcare has become more focused on innovation and technology over the past 2 years, and 80% of healthcare systems are aiming to increase their investment in digital healthcare tool in the upcoming 5 years. A very good evening to one and all present here. Today's lecturate topic is about healthcare sector in India. So, talking about the scenario of the healthcare sector in India, so the healthcare industry comprises of hospital, medical devices, clinical trials, outsourcing, telemedicine, medical tourism, health insurance, and medical equipment. And with that, India's healthcare delivery system is categorized into two major components: public and private. The government comprises limited secondary and tertiary care institutes in key cities and focuses on providing basic health care facility in the form of primary healthcare centers in rural areas. The private sector provides a majority of the secondary, tertiary and quaternary care institution with major concentration in metros, tier 1 and tier 2 cities. Then comes market statistics. So India's healthcare sector is expected to record a threefold rise, and in the economic survey of 2022, India's public expenditure on healthcare stood at 2.1% of GDP in 2021-2022. And if we talk about telemedicine, so telemedicine is also expected to reach USD 5.5 billion by 2025. Then if we talk about the challenges with the healthcare sector, so inadequate access to basic healthcare services such as shortage of medical professionals, a lack of quality assurance, insufficient health spending, and most significant, insufficient research funding. One of the major concern is the administration's insufficient financial allocation. Then low budget. Even neighboring countries like Bangladesh and Pakistan has over 3% of their GDP going through the public healthcare system. But we have recently seen in 2021-22 list that we have just used 2.1% of the GDP. Then comes lack of preventive cares, like preventing cares in undervalued in India, and despite the fact that it has been shown to be quite beneficial in alleviating a variety of difficulties for patients in terms of unhappiness and financial losses. And lack of medical research. In India, research and development and cutting edge technology led new projects receive little attention. Then the policy making is undoubtedly crucial in providing effective and efficient healthcare sector. And shortage in professionals. In India, there is shortage of doctor, nurse and other healthcare professions also. And according to a study presented in parliament by minister, India is short 6 million doctors, and paucity of the resources. Doctor work in extreme condition ranging from overcrowded outpatient departments, inadequate staff, medicines and infrastructure. Then comes the potential of Indian healthcare sector. So India's competitive advantage lies in its large pool of well-trained medical professionals. Cost of surgery in India is about 1/10. The essential exponential growth in this sector include a large population, a robust pharma and medical supply chain, 750 million plus smartphone users, and third largest startup pool. And with that, the funding in innovation tech entrepreneurships look to solve global healthcare problems as well. India will have about 50 clusters for faster clinical testing of medical devices to boost product development and innovation. At last, I just want to give some way forwards related to the challenges. So there is an urgent need to improve the infrastructure of public hospitals, which are overburdened as a result of India's large population. The government should increase private hospital because they make a significant contribution, and because the difficulties are severe and cannot be tackled just by the government, the private sector must also engage. To improve the sector's capability and efficiency, more medical personnel must be inducted. And also, in order to connect the dots in the healthcare sector, technology must be used. Medical gadgets in hospital and clinic, mobile health apps, wearables and sensors are only a few examples of technology that would be included in this sector. Thank you.